Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How Salmonella is treated. Treatment for a salmonella infection usually starts with home remedies and over-the-counter medications. You may need prescriptions or medical care as well depending on a number of factors. This includes the severity of the condition, how long it's lasted, and if you're experiencing dehydration. /r/n/r/n as you cope with the symptoms of a salmonella infection. Following your treatment plan is key to a prompt, successful recovery. /r/n/r/n This article discusses the treatments typically used for salmonella, including home remedies, over-the-counter therapies, and prescriptions. /r/n/r/n Most people recover from salmonella infection with a combination of rest and maintaining adequate fluid intake. Try to take it easy until your symptoms subside so your body can heal. /r/n/r/n Since salmonella infections can cause vomiting and diarrhea, it's important to stay hydrated as best you can. If you're an adult, increase your fluid intake of water, broth, sports drinks, caffeine-free drinks, or unsweetened fruit juices. /r/n/r/n With severe nausea, it can be hard to drink beverages. If that's the case for you, try sucking on ice chips throughout the day, which can keep you hydrated. /r/n/r/n For children experiencing mild to moderate dehydration, an oral solution like Pedialyte can be useful for restoring fluid, nutrients, and electrolytes. /r/n/r/n When you lose more fluid than you consume, dehydration can creep up on you. The signs of dehydration may vary from one person to another and differ based on age. /r/n/r/n For adults, the following are signs of dehydration. /r/n/r/n Children may show the signs of dehydration differently. They may have /r/n/r/n Call your healthcare provider if you or a child is displaying signs of dehydration or unable to keep fluids down. /r/n/r/n According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, certain foods can worsen salmonella symptoms such as diarrhea. /r/n/r/n The foods to avoid include /r/n/r/n When you feel like your stomach is up to handling some food, a mild, bland diet might be your best bet. You might try the BRAT diet, which stands for bananas, rice, applesauce, and toast. /r/n/r/n Research doesn't indicate that this diet is better or more helpful than other ones. However, for some people, the BRAT diet can be a non-irritating way to reintroduce food to a delicate digestive tract. /r/n/r/n Eat small meals when you can tolerate it, and continue to drink replenishing fluids. /r/n/r/n Sometimes a heating pad can ease abdominal cramping. However, it can be uncomfortable for some people who experience vomiting and diarrhea with salmonella. /r/n/r/n If you try it, and it doesn't help you, stop using it. You won't recover more quickly by toughing out something that's uncomfortable for you. /r/n/r/n There are several over-the-counter drugs that may help relieve symptoms of salmonella infection. /r/n/r/n Over-the-counter painkillers, like Advil, ibuprofen, or Tylenol, acetaminophen, may help reduce body aches and pains and lower a fever. /r/n/r/n In some cases, antidiarrheal medications, like Imodium, loperamide, might decrease the abdominal discomfort associated with salmonella. But this type of medication has some drawbacks. Antidiarrheals may extend the length of time you experience diarrhea from the infection. /r/n/r/n In 2013, a team of microbiologists from the University of California, Irvine looked at a probiotic strain of E. coli bacteria called Nissl 1917. They found that while it was originally used to treat the symptoms of irritable bowel syndrome, it may soothe gut infections caused by salmonella. However, the study looked at animal models rather than humans. /r/n/r/n researchers are looking at probiotics as a possible treatment for salmonella, but more trials are needed with human subjects. /r/n/r/n probiotic supplements vary widely in quality and the types of bacteria they contain. If you're interested in the use of probiotics, consult with your healthcare provider to find one that might be right for you. /r/n/r/n Typically, people recover from salmonella within 4 to 7 days without medical intervention. In uncomplicated cases, antibiotics aren't recommended. /r/n/r/n Your healthcare provider may prescribe a course of antibiotics for you if /r/n/r/n Common oral antibiotics for salmonella for adults include fluoroquinolones, such as ciprofloxacin, and azithromycin for children. /r/n/r/n However, antibiotic treatment poses some risks, including an increased possibility of a relapse. Also, antibiotics may extend the amount of time you carry the bacteria. This means it can prolong the stage during which you can infect others with salmonella. /r/n/r/n If you're dealing with severe dehydration or your symptoms are not improving, or are getting worse, you may require hospitalization. At the hospital, you may receive intravenous, fluids or antibiotics. /r/n/r/n Most salmonella infections get better on their own with home remedies. That includes getting rest and drinking lots of fluids, since vomiting and diarrhea can lead to dehydration. You may want to use over-the-counter pain medication for discomfort and fever. /r/n/r/n Your healthcare provider might prescribe antibiotics if you have a persistent infection, a compromised immune system, or an infection that entered your bloodstream. Sometimes hospital care is needed for dehydration or severe illness. /r/n/r/n While salmonella symptoms can feel miserable, they usually go away on their own within a week. If they don't, or you're feeling worse, call your healthcare provider. They can help determine what treatment is needed to improve your symptoms. If you experience a high fever, blood in your stool, or signs of dehydration, seek emergency care. /r/n/r/n Most people who get salmonella recover without specific treatment. In severe cases, antibiotics may be needed to clear the infection. /r/n/r/n Because salmonella can be severely dehydrating, typical treatment is focused on replacing fluids and electrolytes lost to diarrhea. If dehydration is severe, fluids may be delivered intravenously, into a vein, in a hospital. /r/n/r/n Antidiarrheal medications like Imodium, loperamide, are effective in relieving cramps and may reduce the severity of diarrhea. However, they can also prolong diarrhea associated with salmonella. Lamotil, diphenocylate, is contraindicated for use with salmonella infection. /r/n/r/n The main goal of self-treatment is to remain well hydrated. Sports drinks, decaffeinated tea, and broth are ideal. If you have nausea or vomiting, sucking on ice chips or sipping water or ginger ale can help. /r/n/r/n Eat bland foods like bananas, oatmeal, egg whites, and saltines. Avoid caffeine and alcohol, both of which can contribute to dehydration and are irritating to the stomach. /r/n/r/n Most cases resolve on their own with rest and hydration. However, severe cases can lead to potentially life-threatening complications, including shock and septicemia, if left untreated. /r/n/r/n Call 911 or seek emergency care if you have symptoms of severe salmonella poisoning, including :/r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.